Cut the pH paper into half-inch pieces and place them on a folded towel. Connect the light indicator to the socket at the proximal end of the tube. To check the light indicator, allow the tube tip to be attracted to the external magnet. The red light indicator should illuminate. Apply xylocaine gel 2% to one nostril. Then insert the tube towards the back of the head to the nasopharynx and then into the esophagus. When the first mark is 6 inches outside the nostril, the tube tip should be in the mid-esophagus. Insert the proximal end of the tube under a water surface. Absence of rhythmic bubbling with respiration is suggestive of correct esophageal placement. Advance the tube until the first mark is at the nostril. Then apply the face of the external magnet to the skin at the RUQ, area of the gallbladder. As close as possible to the midline aiming towards the vertical column is shown. There should be no gap between the surface of the magnet and the skin. Advance the feeding tube until the second mark is at the nostril. The light indicator should illuminate when the tube is successfully captured by the external magnet. Keep the magnet at the same location while rocking it gently for at least 1 minute to ensure passage through the caloric sphincter. Advance more of the tube through the nose until some resistance is met. You may check pH of the aspirate at this point. The duodenal bulb is usually empty. Aspirate can be attained by injecting 5 cc of tap water, then aspirating duodenal washing. Check the pH at the bedside using pH paper. It should be neutral, pH of 7. Color shade light green. If pH paper color changes to yellow, this indicates placement at the caloric antrum. If pH paper changes to red or orange, this indicates gastric placement, and the tube should be withdrawn until the first mark is at the nose, so that the tube can be properly reinserted. Move the external magnet 4 inches to the RLQ. To attract the tube tip toward the second part of the duodenum. The light indicator should remain on. Aspirate should contain a bile with a pH of 8. The pH paper should turn to a dark green color if the tube has successfully passed through the second part of the duodenum. Please note that in some patients, particularly those with a large frame, the first part of the duodenum travels posteriorly before it turns inferiorly into the second part. You may need to apply the external magnet posteriorly over the costovertebral angle, right renal area, to attract the tube into the second part of the duodenum. The tube can be further advanced through the nose to the third and fourth part of the duodenum by moving the external magnet towards the LLQ. The light indicator should remain on. Aspirate should be bile tinged with a pH of 7.5 to 8. Remove the stylet. Secure the tube at the third mark to the patient's nose and then obtain an abdominal X-ray. X-ray is the gold standard to confirm final tube placement. Remove the light indicator.